So let's go over activity restrictions. Number one, after undergoing the surgery, it is important, really, really important, that you not go swimming and not take a bath. It is okay to take a shower, okay, but immersing the wound in water is a bad idea. It'll significantly increase the risk of wound breakdown, in other words, the wound opening up, which we don't want. It'll also significantly increase the risk of an infection, and that's something we're also trying to avoid. So for the first 4 weeks after surgery, it is okay to get the incision wet in the shower, but it is not okay to take a bath or to go swimming. Okay, that's very, very important. If you have questions or concerns about that, send me a text message or give me a call. You'll notice that on the bottom of this discharge instruction sheet is my cell phone number. Okay, all of my post-operative patients get my cell phone number, and so just give us a call if you have a concern. Send me a text message, give me a call. If what you've read and what you've seen and what you're hearing me say now doesn't make sense, that's available for you as a resource as well. Okay, so you can get the incision wet in the shower, but please don't go swimming and don't take a bath until you've been cleared by me to do so. Okay. Other activity restrictions. For the first 2 weeks after surgery, it is important that you not lift anything heavier than a gallon of milk. Okay? For the first 2 weeks after surgery, don't lift anything heavier than a gallon of milk. The reason for that is that we don't want the wound popping open, and we also don't want you causing a bunch of bleeding that could occur if you overdo it. Okay? So for the first 2 weeks, don't lift anything heavier than a gallon of milk. The third week after surgery, you can lift up to 20 pounds, and the fourth week after surgery, you can lift up to 40 pounds. After 4 weeks, assuming you haven't had any wound healing problems, there are no longer any activity restrictions. Okay, but please try to stick with those activity restrictions in order for you to get the best results. Okay, so that you have fewer problems and decrease the risk of complications, and so that you get a great result, because obviously we're going through the trouble of undergoing surgery. We want you to get the best results possible. Okay. Lastly, if you have any concerns or questions that were not covered in this video or that weren't covered in the written discharge instructions, or there's something that you're confused about and you don't understand, that's a good opportunity for you to call our office or email us, or to send me a text message or call me. Again, you have my cell phone number. Every single one of my post-operative patients gets my cell phone number, so this is the time when you want to text or call if everything we've just gone over is still confusing or doesn't answer a question that you have. Okay, so don't be shy. Let me know if you have any other concerns or questions. And most importantly, please be careful and take care. We look forward to seeing you soon.